came out with the latest guidelines for the use of statins to prevent the first heart attack and stroke. So what impact will that have on heart disease, the #1 killer of men and women? Joining us now is Dr. Jeffrey Berman, Chair of Cardiology at Hartford Healthcare St. Vincent's Medical Center. Doctor, welcome. Thanks for being with us.
Thank you very much, Lisa. Happy to be here.
Great to have you. So this is such an important topic, as we mentioned, the #1 killer. Are the revisions significant, and what is behind this?
Yeah, the revisions are actually pretty minor. The biggest change is that they change from low to moderate statin to just a statin for patients, and the patient groups are the same. So these guidelines say that any person between ages 40 and 75 who has a risk factor for heart disease and has a calculated risk of having an event in the next 10 years of more than 10% should be on a statin. And really that's the main guideline.
All right, doctor, do you agree with these new guidelines?
I do, in part. I think they don't go far enough. I mean, the ACC-AHA, which I'm a part of, that's the American College of Cardiology and American Heart Association, issued their guidelines about statin use as well. And they line up pretty well, but for primary prevention, we recommend anyone with a risk of over 7.5% as opposed to 10%. So a pretty small difference. And I also think that the science has actually moved beyond this calculated risk based on the Framingham risk assessment that's been used for many, many years. And nowadays we're often looking at, for an individual, do they have any evidence of subclinical disease by doing things like a calcium score or an ultrasound of the carotids or of the legs. And then people, no matter what their risk is, if we find that they have the disease, then we recommend treating with a statin.
All right,
and
Doctor.
Conversely,
sorry. We have less than a minute. I just wanted to get in the last question quickly. What's the takeaway for patients here? Should they reach out to their doctor? What should they do?
I think anyone who has any risk factor for heart disease should reach out to their doctor to determine whether they would benefit from a statin. So those are patients with high blood pressure, diabetes, high cholesterol. And the other thing is everyone should be out there exercising. That's probably the best medication of all.
Excellent. Well said, Dr. Jeffrey Berman with Hartford Healthcare St. Vincent Medical Center. Great advice from a cardiologist. We appreciate your time. Thank you.
Thank you very much.